Health, once again, health is an endless example. So I'm chatting away about health all the time because it occurs to everybody that we need to take care of our health, and there's so much we can improve. So, Alzheimer's disease. You know what Alzheimer's disease means?
Oh, okay.
Translate in Chinese.
Yeah, it's just a major topic in the past 2 weeks or 3 weeks in the Chinese CCTV. Pronounce it. Try to pronounce it. Alzheimer. Alzheimer. Nobody understand it? CCTV every day.
Dementia.
My father and mother. The program is called My Father and Mother. 我的父亲母亲，中央电视台这个节目天天都有这个专栏，你没看过？不是，就是那电视这个其他的地方不会没有啊，媒体上不会没有啊。在这个还有在那些什么一些社会媒体那个上面那个网站上，让大家来投票起名什么之类的，大家都没听说？
没有，这没听过。
阿尔茨海默症就是老年痴呆症。
I think the parents of you are too young.
哎，失智老人，后来起名字嘛，就是什么现在叫这个脑退化症嘛。Yeah, they understand.
Yeah. But maybe you don't experience in your own family, but I experienced in my own family.
Yeah, I think they must know somebody suffered from this kind of.
Let me say, in my country, where the number of people over 65 is increasing a lot, right? And by the way, I'm over 65, so I know around myself, right? So in that situation, more and more people get very serious brain problems here that make them lose their memory. Lose their memory from things like, what did they say 5 minutes ago? I cannot remember. Or all of a sudden, I don't remember people that I knew the name. I cannot find the name anymore. Or when I left my apartment, I cannot find the way back. Right? And so this is, in my country, we call this dementia or Alzheimer. And many people get this illness if they grow old. And if you are 60, you have a small chance. If you are 70, there's a bigger chance. If you are 80, there's a bigger chance. And well, so and actually in the UK, at the moment in the UK there live about 60 million people. So it's a small country compared to China, right? But there's at the moment there's 750,000 people having Alzheimer. But they expect in 2050 it will be 2 billion. So 3 times.
So it means maybe in UK 1% of the population.
It's now about 1%.
Yeah.
Yeah. But in 2050 will be about 3%.
Yeah, I think in China just the same percentage.
Yeah.
In China, big population.
Yeah.
Yeah, people.
Yeah. So it's really serious. So let me give you some examples. So social isolation. This is what happens because people don't remember. I spoke to you like half an hour ago, and now I go to you and you don't know me. This is not nice. Yeah. So I'm not going to you anymore, right? Because we cannot talk. And people can no longer go to the shop because when they go to the shop they cannot find their house back. Yeah. So this is social both for the people and for the caregivers. So if I'm taking care of my father who has dementia, Alzheimer, then it takes me a lot of time and I'm isolated from other people because actually in my society sometimes people don't want to talk about it. People are a little bit ashamed. They think it's a funny disease. Right? And because people who have Alzheimer, they are no longer able to discuss, to communicate. to take care of themselves. Later on they are not able to dress themselves, to wash themselves. So it's getting worse and worse all the time. It's not stable, it's getting... So you get isolation for the people themselves and for the caregivers. And there's a lack of public awareness and there's a stigma. So it's something you don't talk about. These are funny people, right? So, and there are services, but it's difficult to find the right services you need, at least in my culture. And on the other hand, people with dementia, people with Alzheimer, once you know, then you say, just sit here, I will take care for you. Because that's easy. Which means that you don't take the people for a walk. You say, stay at home, I will do the shoppings. Because taking them to the shop to go and buy things is a hassle. Because they don't walk very well, they talk funny things to people in the shop. So you better leave them at home and do the shopping yourself. Which doesn't help them, because it isolates them even more, right? So you will be too protective. And really taking care of people with dementia is a full-time job.
Yeah.
Because people, they don't know to go to the bathroom. They need help at a certain moment for everything. So it's a 24-hour-a-day job. So I will give just 3 examples of a case and of how you could improve the life of people. So the first case is Bill. Bill is 56, which is actually very young for dementia, but it happens regularly. And he has 2 children and they live 50 minutes away. And this is what Bill's saying. My life changed a lot over the past couple of years. Being diagnosed with Alzheimer means I have to rely on my family much more. He still knows, he understands his case. And he said, I'm lucky to have a good group of friends. At first it was a bit strange, but they are beginning to understand that I'm still me. So his friends started to accept that he has Alzheimer, but it's still Bill. One of the hardest things was losing my job. Things that I was doing every day I couldn't remember. But so he is telling his story here. And this means we lost our income and went on disability allowance. So he got some kind of state money to survive. And what amazed me most was how I missed the workmates. He missed the colleagues at work because he couldn't go to work anymore. And now he said, I have more time to enjoy my hobbies. And I've been introduced to other groups in similar situations by my GP. GP is the medical doctor. So the medical doctor put him in contact with other people that also have Alzheimer. And this helped. Because now he has fun with his hobbies. And the fun and humor of the group get me through tough days. So the group, in fact, helps each other, right? I couldn't have got strong without Susan. This is his wife, and sometimes we argue, but we support each other, and that got us through. So he is aware of the caregiver, the first place caregiver, right? So this is the first case. You can see how services like a group of other people in the same situation and a medical doctor who says, talk to these people, they have the same problem, and go to them. This helps. So this is Betty. Now Betty is 80 and she lives alone. And her children live far away. So she's a retired school teacher and her husband died 10 years ago. And then, a couple of years later, she was diagnosed Alzheimer. Now, Betty's story. I felt very isolated when I was diagnosed. My family wasn't around, so she didn't have a caregiver. For a few years, I felt lonely and nothing to do. All I thought was about the past, which made me feel content. And I started from my old home, and my neighbors say I spent hours searching, because she was walking around, thought that she was still living at the old address, right? So. And now she attends a day club. This is a service, a day club where I have lunch and have made new friends. I feel safe. It's good to talk to people. I talk about my old life. And my neighbor says that I don't wander as much as anymore because she has now a club to go there and she is no longer searching for her old home too much. Right? So this simple service helps. This is Margaret, 27, married with Howard. And she had 3 children, and they have grown up and left the area where she has been diagnosed with vascular dementia. This is an illness that's not actually Alzheimer, but it's pretty much the same from the outside. And this is her. I went to see a consultant who diagnosed that he had a memory problem. And Margaret says, a memory problem? Everybody my age starts to have bad memory. So denies. She doesn't want to know. She said, everybody of my age complains about memory, right? And Howard keeps saying that I'm forgetting things, but I don't know what the fuss is about. He says that we need to tell the children, but what to tell them? We can look after ourselves. So this is an example of an Alzheimer patient who, in a way, denies. She says, well, everybody my age forget things, right? Nothing special. I say that. I say, I forget things, Ellie will help me remember, right? That's true. So, this is normal, right? I used to host afternoon tea for the Women's Institute, so she organized the clock. But I should be seen, but I'm too busy at the moment, so she doesn't really understand what's going on. And Howard said, I should be seeing people more. He keeps talking about a day club. A day club, I'm not open for that yet. So you see, sometimes it's difficult to provide the service. There is the service, the day club is there. But sometimes people say, this is not for me, like I'm not going to the doctor, or I'm not going to university, or whatever, right? So people sometimes, there are services and they don't go. And well, I think that I like this example because it shows that if you want to provide public services, sometimes you have to drag the people to the service. Say, here, there's something for you to help. Because they say, no, it's not for me. I'm not old enough, or this happens to anybody, or it's too far away, or my income is too low, and so help people to find. So, now, so that you could have a dementia advisor. So this is a kind of a broker that could help people with dementia or the family of people to say, this is what you can find. There's a day club, there's this possibility, there's that possibility. So, because if people discover, they have to make decisions and to find which service and information would help for them, right? And so, and a co-design workshop, so a workshop like we have here could develop something like Think Public. It's just a name, but it would be advantage if the key person would help people through the early stages of dementia. In the early stages, people still know. They say, I was recently diagnosed dementia, and this is my problem. Like, and some people, like the last example, she said, I have no problem, right? And so, but if people still understand the problem, it's the time to help them. And the same is for education, and the same is for healthcare in general. So, and then there's a think bank for volunteers, because caregivers, they spend a lot of time. If your husband or your father or your mother is diagnosed with Alzheimer or dementia, and you want to take care, you spend hours and hours and hours every day. So you need a way to help these individuals to in a way spread the load between people, right? Friends and family want to help out, but they don't know how to. So organize something, organize a time bank so that everybody takes care for the patients. And volunteers could, let me say, pay time credits, which is just funny money. It's not real money, but you could say each of us should spend 20 hours a month, right? So you already spent your 20 hours. I won't see you back until next month. You did only spend 15 hours, so you should help me next week, right? So, and this is service design, right? And at a very low level, and there's no official companies or institutes involved. It's just people, and maybe you need a broker to help to organize. And the Dementia Cafe, and this is something that I even see in my country now, where people with Alzheimer can go there and talk to other people who have the same problem, and talk to people who understand the problem and help them a little bit, give them hints. Sometimes just play simple games that they can still understand and have fun to be there, right? And at the same time, the people in the Dementia Cafe don't care if people forget what they said 5 minutes ago. They just laugh, and they continue to laugh about the same joke for 10 times in a day, right? Because they understand. And we need to speak openly about dementia. So we should be not hiding it, not saying this is something that these are funny people, but be open about it, be open about the problem, and be open about the solutions. So the Dementia Cafe, it's now run in Northeast England, but actually it's also running now in the Netherlands, and maybe in many different countries. Okay, the next chapter is design options. Maybe we